Yeah.
Good evening, everyone, and welcome to another edition of Ask Nanavati Max Expert live session. Today, we have Dr. Sojanya Agrawal, Senior Director, Obstetrics, Gynecology, Infertility, and IVF at Max Super Speciality Hospital, Vaishali. Dr. Agrawal specializes in IVF, infertility, laparoscopic gynae surgery, robotic gynae surgery, and more. Today, she will share expert insights on fertility after 30 and the key factors every couple should understand before planning a baby. So, doctor, over to you.
Yeah, hi, good afternoon, everyone. So, today let's discuss about fertility after 30. How many of you have heard that after 30 years, there will be a difficulty in conceiving? Actually, it's a myth. So, definitely, time does matter, but you should know that there are a lot of successful pregnancies even after 30. So, when actually what happens after 30? When you age more than 30 years, the egg quality and quantity starts declining. And after 35, it starts declining very fast. The same thing applies for men too. The motility and the DNA integrity of the sperm also declines as they advance in age. So basically, you need to just have a basic investigations whether you are healthy according to your fertility potential. Now, when you actually need to seek advice from us, if you're married, your age is less than 35, and you're planning a pregnancy and you have tried for 1 year, then you need to see us. And if you are more than 35 years and if you have tried planning a pregnancy and it has not happened, then you have to meet us at 6 months only. At the same time, if you are suffering from PCOS, irregular menses, or if you have any concerns of endometriosis, then you need to seek help in the first 6 months of you trying your pregnancy. Because these issues do create a problem to conceive, to get pregnant. The same way, is everybody thinks no, fertility is only a female problem. No, actually it is a couple problem. So 30% of the problems are in females, 30% of the problems are in males. There is a 30% where both the couples, both the husband and wife might have problem, and a 10% of them maybe none. There is no problem, where we term it as unexplained infertility. So now what actually happens once you have planned and when you see us? So what are we checking? So for a female, we need to check, for a wife, we need to check her hormonal status. What is the egg reserve she has? Her thyroid status, her prolactin status, and a routine ultrasound to check whether her uterus, tubes, and ovaries are all normal. At the same time, we need to check for the husband his semen analysis, where the semen count, motility, and morphology of the sperm is checked whether the semen or the sperm is able to fertilize the egg or not. At the same time, if the pregnancy has been planned and it has not happened in 1 year of trying, then we need to even check the tubes. The tubes play a very important role of fertilization actually happens in the tube. So we need to check whether the tube is open or not. Now, uh, as we see currently, due to many occupational, as an occupational hazard, lot of pregnancies, or many people are working late nights. The husband and wife or the couple being together, the chances are, the actually when the ovulation happens, it happens approximately on the 14th or 16th day of her cycle during her 28 to 30 day regular cycle. So when the 14th day or 16th day, when they keep contact or when they have an intercourse, the sperm which is released can go gets inside, meets the egg, and then an embryo is formed which comes and gets fertilized and gets implanted in the uterus. Now, if that golden period is missed, then the wife doesn't get pregnant during that month. So everybody needs to know the exact timing of the ovulation. So in next 1 year or 6 months after 35 years, if they are not getting pregnant, then they might have to undergo these treatments. You need just basic treatments with simple treatments alone, like ovulation induction with simple IUIs and simple corrective surgeries. Most of them do get pregnant. By chance, if they don't get even pregnant with all these, then probably an IVF is advised. So nowadays, I hear a lot of people saying after, oh, I am not okay, I'm okay, I'll do IVF later. If I don't get pregnant, I'll do IVF later. But again, everybody should understand, even after 35, IVF also depends on the age. The success rate again depends on age. As early as you get, the success rates are better. As late as you get an IVF done also, the success rate again declines. So today's session is only to inform you that you can try your pregnancy. If you don't get pregnant, just get your basic investigations, basic workup done. Just be assured that everything is normal, and then you can plan. And if you need help, seek an infertility specialist so that you understand exactly what the problem is. Thank you.
Thank you, doctor. We have a couple of questions coming in from the audience. The first question is it really harder to conceive after 30, or is that just a common perception?
See, it's not, as I told you, it's not very hard. I have seen a lot of pregnancies after 30 and after 35 too, but definitely a timely decision does matter. If you have not planned till 30, definitely I will advise that you have to get start planning. And once, if you do not conceive after 1 year, then you can meet us and just check your all investigations, whether your potential is okay, your AMH, egg reserve is okay, the husband's sperm is okay or not.
We have another question. At what age does fertility start declining for women, and how significant is the change after 30?
Okay. See, as early as we know, okay, before 30 years, definitely the eggs are very healthy. Even after 30, the eggs are healthy. But every woman is born with a certain number of eggs. If the eggs go in, as you age, the eggs are going to go down. It just like think as if it is a bank account. You can just withdraw, but you cannot add. The same thing for women. Every month on month, the egg count keeps going down, and after 35 years they drastically reduce faster. At the same time, as you age, like after 35, the quality of egg also decreases, and the chances of having a genetic abnormality or aneuploidy in the baby also increase after 35 years. So you have to be concerned. After 30, it is still fine, you can plan a pregnancy, but after 35, definitely it starts declining for women.
Thank you, doctor. Another question we have is, if a couple starts trying after 30, how long should they try naturally before consulting a doctor?
See, a couple, when they start trying, every cycle they will have only around 10 to 15% of chance to get conception. So they should at least try for 1 year as a proper timed intercourse. So if they try for 1 year, then if they don't get pregnant even after 1 year, then they need to seek us. If the couple is more than 35 years of age, then we will suggest that they should meet us even before. That is, after 6 months of trying itself, you need to meet us. And if the wife is already suffering from PCOS or any hormonal imbalances which is causing irregular periods, or if she has endometriosis, then they should meet us early. At the same time, if you also know the husband's semen count is low or his motility is low, then again you need to meet us.
We have another question. Are there any early signs that fertility might be declining that couples should watch out for?
See, the main signs are if you have any irregular cycles, if you have heavy menses, and you have hormonal abnormalities like excessive facial growth, excessive weight gain, you're too obese. So these again we have to just have a regular checkup. For male factors, only a semen analysis alone will let us know. So we will suggest, if you have been trying, just get a basic investigations done.
The following question is, how much does male age affect fertility when planning a pregnancy after 30?
See, definitely even in males also, we have seen the motility comes down as the male advances. At the same time, even the DNA integrity also comes down. So the fertilization potential in males also is going to come down. So at least if you're planning, so plan, and if it is not happening, again consult.
We have another question. What basic health checks or tests should couples consider before planning a baby after 30?
So, whenever you're planning a baby, as I told, you need to get your regular health investigations, normal hemogram, but the main tests which include for a female will be anti-Mullerian hormone, which will let us know her ovarian reserve. Her thyroid levels have to be normal, so we need to know her thyroid levels, a serum prolactin level. At the same time, we need to know the thalassemic status, HPLC, of both husband and wife, and whether the wife has been immunized for rubella or not. For males, we need to get the semen analysis done to understand whether his semen parameters are normal or not. These are the basic infertility investigations what we do for a couple whoever are planning to get pregnant.
Thank you, doctor. Another question we have is, do lifestyle factors like stress, sleep, and diet really impact fertility at this stage?
Definitely. These are the main factors nowadays, considering nowadays lifestyle. So, having a nutritious diet, a regular exercise definitely improves fertility potential of women and men. At the same time, smoking and alcohol decrease the fertility potential. So, any couple whoever are planning pregnancy are advised to quit smoking and stop alcohol. At the same time, reduce your stress, because again stress increases the damage to the fertility of both the couple. So you need to reduce stress, and a good 6 to 8 hours sleep in the night is very essential for the couple to have a good fertility potential.
Moving on to the next question. Many couples delay pregnancy due to career goals. Does that significantly increase risk later?
Definitely, yes. As I told you, above 35, the chances become less. So nowadays, we advise women, if due to career goals, if you are planning to postpone your pregnancy, please do get a basic checkup. And if your AMH or anti-Mullerian hormone or ovarian reserve looks like it is decreasing or it is declining, then please get your eggs freezed. That is freezing of oocytes. And if you're married, then get your embryos frozen with us, so that whenever you plan pregnancy later in life, you are at least at the back of your mind, you are safe that your eggs have been frozen. So in these cases, whenever we say after 35, if you're planning to postpone, at least try to get your investigations done to know whether you postpone it for a long time or not. And if you're thinking to postpone it for a long time, or if your values are less, then at least get your cryopreservation or freezing of eggs or embryos as needed.
The following question is, are irregular periods after 30 always a sign of fertility issues?
See, we cannot exactly say, but again, irregular periods suggest that your ovulation is not happening properly. Normally, if they have a regular period, that is, in some patients we see 24 days, 24 to 26 days they have cycle. In some patients, it's 32 to 34 days. That is still okay. But if you have period cycle after 35, like 40 days, 45 days, we cannot say whether your ovulation is happening or not. Ovulation means the egg releasing or not. If egg itself is not released, then pregnancy cannot happen. So you have to understand that irregular periods might suggest that you will have some problem in pregnancy. In that case, like you might have a PCOS or you might have any other hormonal problem, just need to get yourself checked so that we can advise you or we can help you to have your ovulation and can help you to get you pregnant.
Thank you, doctor. Another question we have is, does fertility treatment become more common for couple trying after 30?
As I said, it is not mandatory, but yes, the percentage of patients who are planning to get pregnant after 30 is now increasing. So, what we see as a infertility percentage in the society now is slightly increasing because of their lifestyle, the stress associated, and other factors. So, we will suggest that yes, after 30, if you are planning to postpone or then get yourself investigated.
On to the next question. What role does weight or hormonal imbalance play in fertility after 30?
See, again, this is a very good question because most of them are having issues with their weight. Obesity does play a major role in declining fertility, both in men and women. In women, it causes irregular cycles where the periods are not happening regularly. Again, egg is not releasing properly, and again, they are having fertility problem. So, definitely, reduction in weight and maintaining a healthy weight helps her to get pregnant, at the same time to carry a pregnancy also well, because if she is obese in the initial itself, then there are problems which are present during the whole pregnancy. Having like diabetes, hypertension, these all problems are also happen during pregnancy when the patient is obese. So we certainly advise that if she is trying to get pregnant, to have an ideal or a better weight. At the same time, for males also, if they are obese, we have seen there is a high chance that it affects the semen parameters. So, to maintain an ideal weight and have a healthy weight is definitely necessary to get pregnancy.
On to the next question. Are pregnancies after 30 automatically considered high risk?
See, the first pregnancy after not 30 but after 35 definitely becomes slightly more high risk. But after 30 again, we have to be careful because once they get pregnant, there are chances of increase in blood pressures during pregnancy, increase in sugars during pregnancy. Again, all of this will cause slightly complications in pregnancy. That is why they are termed as high risk pregnancies. But usually these happen after 35. But if you're in 30 itself, if you're obese or you have smoking, alcohol, other lifestyle problems, then we will suggest that they need to correct these.
Thank you, doctor. Another question we have is, what is the one piece of advice you would give couples who want to start planning for a baby after 30?
Yeah. So after 30, we'll suggest that you should plan pregnancy. Do not postpone it for a very long time. And if you are having any problems, please at least consult us, have a basic investigation so that at least you'll be relieved of the tension and anxiety and the stress. And even if it is like after 1 year you want to plan or 2 years you want to plan, but at least visit us so that your basic investigations are done and you can have a healthy lifestyle, improve your lifestyle. So whenever you plan, you can get pregnant naturally.
Thank you very much, Dr. Agrawal, for your valuable insights and precious time. Please share a concluding message that you would want to pass on to our audience.
Thank you all. And see, don't get scared, or I didn't want to scare anybody that after 30 that everything is fine. You should start planning and just need to know that after 35 definitely you are